Hello everyone. This is an overview of everything I have learned in Health Science 410, which I really enjoyed. I titled this presentation My New Outlook on Aging because that is what I gained from taking this course. My team was the first to present our selected topics about the body systems. Our textbook and other research sources provided helpful information and taught me many things that I did not know about physiologically aging. I had no idea that elderly individuals are more prone to dehydration due to medications, desensitized thirst sensation, and decreased desire to get out of bed for a drink. My group worked very well together, and I was fortunate to have such a great team. Thank you, ladies, for working hard and adding quality information to our group presentation. Another aspect of this course that opened my eyes to the needs of the elderly was taking the home safety checklist. There would be no way that an elderly individual could live in my apartment. There are no grab bars, chairs, rugs, and tables obstruct every pathway, and the stairs are too narrow. I could not believe that my landlord did not provide us with a fire extinguisher or carbon monoxide detector. What would we have done if there was actually a fire? I also was concerned about carbon monoxide because our pipes froze over the winter and we had 3 space heaters running, which are known to produce carbon monoxide. Throughout the semester, we had many presenters speak about their career specialties in terms of the elderly. The topics included home safety, designing environments, medications and complications, physicians-assisted suicide, Social Security, and Medicare. Each of the presenters were very informative, and I learned a lot. My favorite presentation was Dr. Fernando's discussion about the environments in which elderly individuals live in and how environments could potentially affect the progress of diseases or an individual's recovery. Since this presentation, I am more aware of my surroundings regarding the elderly. Whenever I walk into a bathroom, I always ask myself, could a wheelchair get through here? It is amazing how much one presenter could change my outlook on everyday life. As the semester progressed, many more teams presented their chapter topics. I really enjoyed the diet analysis presentation because I believe that learning about different diets is an important part of being in healthcare. When someone mentions that they are in healthcare, it is an immediate response for people to think that you know a lot about being healthy. This is what I have observed over the years of watching my mom, who is a chiropractor, interact with her patients and people asking me about my major. Knowing what diets are out there and what includes that diet will help us become better informed healthcare professionals. Of the diets we have studied, I am partial to the paleo diet. I personally stick to the paleo diet in the summer because fresh vegetables and fruits are readily available from farmers markets and are not too expensive. When I stick to the requirements of the paleo diet, such as lean meats, fresh vegetables, and fruit, I have more energy and don't get sick as often. Also, my allergies aren't as bad. The diet presentation group also focused on MyPlate and how important it is to stick with the recommended portions at every meal. Most individuals are not likely to eat according to MyPlate at every single meal, but an attempt to follow MyPlate is a great start for a patient that has never been conscious of the nutritious value of the food they are ingesting. I will stay current with the average MyPlate and also the MyPlate for the elderly. Staying current and aware of the FDA's guidelines for health will help my future patients also stay aware of what is considered having a healthful diet. Overall, Issues in Aging was one of my favorite classes here at UWSP. I am so glad that my pre-occupational therapy major required me to take this class because of everything I learned. The elderly population is going to dramatically increase due to the baby boomers turning 65 and older. I will apply the knowledge I have learned through this course to better inform my elderly patients. I now know and understand how to respect the differences between cultures, education level, and language barriers. Applying the information that I have learned will help me become a better occupational therapist and healthcare professional. Thank you, Nance, for being so positive, fun, and a great teacher. I truly learned a lot.